Hello everyone, I would like to present a poster on nutraceuticals for preventing COVID-19 today. So let's begin. I hope you like this video. COVID-19 has disrupted global health and economic well-being since the beginning of 2020. The Regional Office of World Health Organization in China was first alerted to the virus infection in Wuhan on December 31st, 2019 and termed the infection as an epidemic on March 11, 2020. Since then, laboratories across the globe have been collaborating to develop vaccines and therapeutic agents for this novel coronavirus. The COVID-19 pandemic is a public health emergency and has got world and regional organizations, government and healthcare systems working tirelessly to control the spread of the virus and managing the already infected individuals adequately. There are many guidelines for the common people issued by many respected organizations, but most of them are focused on personal hygiene, prevention and spread of the virus. Only minimal focus has been towards the role of immunity in this scenario and more importantly, the role of nutrition in supporting immunity. These events have made everyone realize the policy of prevention is better than cure as the best way to fight this pandemic. So let's understand the term nutraceutical, which most of us are aware of. The term nutraceutical combines the word of nutrient, which is a nourishing food component, and pharmaceutical, which is a medical drug. The name was coined in 1989 by Stephen De Fellis, founder and chairman of Foundation for Innovation in Medicine, which is an organization located in Canford, New Jersey, America. The philosophy behind nutraceutical is to focus on prevention according to the saying by a Greek physician Hippocrates, who said, "Let the food be your medicine." Their role in human nutrition is one of the most important areas of investigation with wide-ranging implications for consumers, healthcare providers, regulators, food producers, and distributors. Within the spectrum of nutraceuticals included are natural foods rich in nutrients as garlic, spirulina, etc., or a particular component as omega-3 for salmon. Thus, this broad umbrella of nutraceutical ranges from isolated nutrients to genetically engineered food to herbal products and also processed foods as cereals and soups. The potential nutritional benefit accompanied by therapeutic effects with presumed safety has led to considerable interest in the nutraceuticals. Over the past several years, nutraceuticals have attracted considerable interest due to their potential nutritional safety and therapeutic effects. These products could have a role in a plethora of biological processes, including antioxidant defenses, cell proliferation, gene expression, and safeguarding of mitochondrial integrity. Therefore, nutraceuticals may be used to improve health, prevent chronic diseases, postpone the aging process, and in turn increase life expectancy or just support the functions and integrity of the body. These products are considered to be healthy sources of prevention of life-threatening diseases such as diabetes, renal and gastrointestinal disorders, as well as different infections. A wide range of nutraceuticals has shown to impose crucial roles in immune status and susceptibility to certain disease states. Nutraceuticals also exhibit disease-modifying indications related to oxidative stress, including allergies, Alzheimer's disease, cardiovascular diseases, cancer, eye conditions, Parkinson's disease, and obesity. This poster has tried to shed some light on the fact that these nutraceuticals deserve to be promoted amongst the masses to support the immunity required against infectious diseases. So let's understand an overview of the present understanding of the viral life cycle and host immune responses, which would form the basis for selecting nutraceuticals and natural products that can be potentially explored both as therapeutic and preventive interventions for the SARS-CoV-2 infection, that is COVID-19 virus. This flowchart is interlinked immune signaling pathways and metabolism. It's quite complicated, but I will try my best to make you understand that the green box represents adipocytes, orange box represents hepatocytes, and purple box represents pancreatic cells. The green arrow represents the metabolic processes and the cellular machinery processes. The blue arrow represents the immune response elicited by molecules or the factors, and the red line represents its inhibition. The PPARs and the PGC1 alpha present in the cells influence adipokines and the beta oxidation. The blue dotted line represents its regulation, that is, either upregulation or downregulation. The immune signaling involved during the metabolism processes include release of pro-inflammatory cytokines by adipocytes, that is TNF alpha, IL interleukin 6 or VGF-A, etc. Inhibition of lipolysis via activation of AKT pathway, inhibition of insulin function by adipokines, and activation of AMPK pathway, which upregulates PGC1 alpha, further enhancing beta oxidation. So this results in inflammation in hepatocytes through the JNK and MAPK pathways, which release pro-inflammatory cytokines that can inhibit beta oxidation and expression of beta cells in pancreases. So this whole black box represents SARS-CoV-2 infected cells, where the MCP1 causes macrophage infiltration and the orange circle, and at the site of infection resulting in a decrease in HDL levels, loss of PON1 enzyme activity, and increase in oxidization of LDL. This also results in the activation of inflammatory pathways, JAK-STAT and NFB pathway, and hence the cytokine storm. So this is really interesting to observe in the structural similarities among these molecules, that having a catechol moiety seems to be a common feature in these nutraceuticals. These molecules target different viral proteins at different stages of viral replications, and a majority of them are common ingredients of the food chain, like turmeric, then carnosol from rosemary, quercetin in apples, etc. And it can be assumed that consumption of such foods may be possibly and positively have an impact protection against the SARS-CoV-2 infection. So here is a chart which represents that nutraceuticals can be used in the management of metabolic disorders that are suitable interventions to alleviate the problems in a COVID-19 patients. Nowadays, despite enormous scientific advances, viral diseases remain the leading cause of morbidity worldwide, and the potential to spread is escalating, eventually turning into pandemics. Nutrition can play a major role in supporting the immune system of the body and for the optimal functions of the cells of the immune system. A healthy diet containing vitamins, multi-nutrient supplements, functional foods, nutraceuticals, and probiotics can play a major role in combating several viral invasions in addition to strengthening the immune system. Studies have also revealed that many details about SARS-CoV-2 viral infection, that we have gained an insight into COVID virus pathogenesis. A definitive treatment course is still distant. In such times, the intelligent way is to maintain the best possible health by taking suitable adjuvants to avoid falling ill. It is really evident that there are many ingredients that can be included in daily diet to possibly gain immunity or protection against coronavirus. Polyphenols, leguminous seeds containing plant protease inhibitors, as well as proteins such as which have jackfruit seed protein, could be literally incorporated in our daily diet. Other bioactive polyphenols such as EGCG, then GCG, which are common constituents of these are other bioactive polyphenols which are present in green tea. Quercetin is found in apples and hesperine is found in citric fruit. So we can see that these all are present in our daily diet, in our daily cuisine. And spices such as turmeric, thyme, rosemary, garlic, these all have anti-inflammatory properties. So we can have them in our daily diet and increase our immunity, and these can be used as a prophylactic treatment for the COVID-19 virus variant. In the conclusion, this current whole poster highlights the potential benefits of a range of nutraceuticals in the management of COVID-19. Thank you so much. Stay safe, stay healthy, stay tuned.